Coronavirus hospitalizations are on the rise in Hampton roads, and children are not exempt. The head of Children's Hospital, the King's Daughters, said he's noticed an uptick in pediatric COVID cases and resources are stretched. But doctors stress they are not at capacity and they're not turning anyone away. Dana Smith is live in Norfolk now with the warning, though, for parents. Dana.
CHKD says they're not running out of beds, but they've had more hospitalizations this month than they've had at any point throughout the entire pandemic.
Are we seeing an uptick in hospitalizations? Yes.
Dr. Douglas Mitchell is the medical director of Children's Hospital of the King's Daughters Medical Group. He said his team is definitely seeing an increase in the number of pediatric COVID cases and other respiratory illnesses.
We've had more hospitalizations in August than we've had in the entire course of the pandemic. And the kids that we're seeing this month are sicker than we've seen before.
A chart on the Virginia Department of Health website showing monthly COVID-19 hospitalizations shows an upward trend for younger age groups. Across the U.S., pediatricians say more and more children are showing up at the hospital sick with coronavirus. CHKD is not exempt.
It's not just news from across the country. It's hitting us here at home as well.
As kids head back to school and COVID cases rise, Dr. Mitchell said he wants parents to know there is a solution. The key to getting out of the pandemic is vaccinations.
So that we don't have outbreaks in the schools, the emphasis, it should be and can be and needs to be on vaccinations.
Dr. Mitchell said most of the children and adults, for that matter, who wind up in the hospital with COVID are not vaccinated. I'm live in Norfolk. Dana Smith, 13 News Now.
Right now, the Pfizer vaccine is approved for people 12 and older. Health experts say the shot is proven to prevent severe cases of COVID-19. You can get one for your child at local pharmacies, vaccination clinics, or your doctor's office, including CHKD.